Subscribe to our YouTube channel and press the bell icon to get the latest updates.
जब हम एंग्जाइटी के बारे में बात करते हैं हमें लगता है वो एक ही टाइप का होता है और सबको सेम टाइप की एंग्जाइटी होती होगी. Nothing can be further from reality. Occasional anxiety सभी के लाइफ का हिस्सा होता है, but anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. I am going to discuss a few kinds of anxiety disorders in today's episode. Generalized anxiety disorder. People with generalized anxiety disorder display excessive anxiety or worry most days for at least 6 months about a number of things such as personal health, world, social interactions, and everyday routine life circumstances. Generalized anxiety disorder symptoms include feeling restless, wound up, or on edge, easily fatigued, difficulty concentrating, irritable, difficulty controlling feelings of worry, having sleep problems such as difficulty falling or staying asleep, restlessness, or unsatisfying sleep. Panic disorder. Panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Attacks can occur unexpectedly or can be brought on by a trigger, such as a feared object or situation. During a panic attack, people may experience heart palpitations, a pounding heartbeat, or an accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath, smothering or choking, feelings of impending doom or of being out of control. People with panic disorder often worry about when the next attack will happen and actively try to prevent future attacks by avoiding places, situations, or behaviors they associate with panic attacks. Phobia-related anxiety. Phobia का मतलब होता है intense fear of or aversion to specific objects or situation. Although it can be realistic to be anxious in some circumstances, the fear people with phobia feel is out of proportion to the actual danger caused by the situation or object. What happens when you have a phobia? May have an irrational or excessive worry about encountering the feared object or situation. Take active steps to avoid the feared objects or situation. Experience immediate, intense anxiety upon encountering that object or situation. Endure unavoidable objects and situations with intense anxiety. There are several types of phobias and phobia-related disorders. Specific phobias have an intense fear of or feel intense anxiety about specific kind of object or situations. Some examples of specific phobias include the fear of flying, heights, or particular insects, etc. For example, in my case, I have aquaphobia, which is the fear of drowning. In my case, it was due to a near-drowning accident when I was very young. Social anxiety disorder, which was also previously known as social phobia. People with social anxiety disorder have a general intense fear of or anxiety towards social or performance situations. They worry that actions or behaviors associated with their anxiety दूसरे लोग evaluate करेंगे negatively और उससे उन्हें embarrassment feel होगा. This worry often causes people with social anxiety to avoid social situations. Agoraphobia. People with agoraphobia have an intense fear of 2 or more of the following situations. Using public transportation, बद जगहों पे रहना, standing in line or being in a crowd, घर के बाहर अकेले रहना. Researchers say that both genetic and environmental factors contribute to the risk of developing an anxiety disorder. Although the risk factors for each type of anxiety disorder can vary, some general risk factors for all types of anxiety disorders include temperamental traits or shyness or behavioral inhibition in childhood, exposure to stressful and negative life or environmental events in early childhood or adulthood, a history of anxiety or other mental illnesses in biological relatives. Some physical health conditions such as thyroid or heart arrhythmias or caffeine or other substances or medication can also produce or aggravate anxiety symptoms. इसीलिए physical health condition को examine करना अक्सर helpful रहता है. जिन लोगों को पानी से डर लगता है, it makes them anxious. This is different from someone who is beginning to learn swimming and fears the water. अक्सर swimming trainers beginners को कहते हैं कि just jump and the fear will go. But if you have hydrophobia or aquaphobia as a clinical symptom, then the professional has to tackle it very differently. Treatments and therapies. Anxiety disorders are generally treated with psychotherapy, medication, or both. There are many ways to treat anxiety and लोगों को अपने डॉक्टर से कंसल्ट करके डिसाइड करना चाहिए कि कौन सा ट्रीटमेंट प्लान उन्हें अपनाना चाहिए. Psychotherapy can help people with anxiety disorders. To be effective, psychotherapy must be directed at a person's specific anxieties and tailored to his or her needs. Cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is an example of one kind of psychotherapy that can help people with anxiety disorders. It teaches people different ways of thinking, behaving, and reacting to anxiety-producing and fearful situations and objects. CBT can also help people learn and practice social skills, which is vital for treating social anxiety disorder. Medication. Medication does not cure anxiety disorders, but can help relieve symptoms. Medication for anxiety is prescribed by doctors such as a psychiatrist. It cannot and should not be usually prescribed by a psychotherapist. However, as National Institute of Mental Health says, some states do allow psychologists who have received specialized training to prescribe psychiatric medications. The most common classes of medications used to combat anxiety disorders are anti-anxiety drugs, antidepressants, and beta blockers. Support groups. Some people with anxiety disorders might benefit from joining a self-help or support group and sharing their problems and achievements with others. Nowadays, there are multiple support groups available online, especially after the onset of COVID. These can be really helpful. लेकिन जो भी नॉलेज इंटरनेट में मिले उसे थोड़ा सोच समझ कर या क्वालिफाइड प्रोफेशनल से कंसल्ट करके ही फॉलो करें. Internet acquaintances have usually never seen each other, and what has helped one person is not necessarily what is best for another. You should always check with your doctor before following any treatment advice that you find on the internet. Stress management techniques. Stress management techniques and medication can help people with anxiety disorders calm themselves and may enhance the effects of therapy. Research suggests that aerobic exercises can help some people manage their anxiety. In my case too, a good workout helps me feel better. But ये याद रखना ज़रूरी है कि exercise should not and cannot take the place of standard care. That would be too simplistic. Fitter everybody would be recommending meditation, yoga, and gym for all mental health issues. Therapy, medication for serious symptoms cannot be easily substituted. Thank you for watching this episode of Mind Over Matter. अगर आपको ये एपिसोड अच्छा लगा तो प्लीज़ इस वीडियो को लाइक और शेयर करें और हमारे YouTube चैनल को सब्सक्राइब करें. हमें हमारे सोशल मीडिया हैंडल्स पे भी फॉलो करें.